Hello, good afternoon, good morning, or good evening from the World Health Organization headquarters in Geneva. My name is Alexandra Kuzmanovic, and today I'm joined by Dr. Janet Diaz, who is WHO COVID-19 Clinical Care Lead. We will talk about post-COVID condition, or so-called long COVID, that many people who have been infected with the virus are affected with the post-COVID condition as well. We are also joined by Joni Savolainen, who is a representative of Long COVID SOS Group. Good afternoon, Janet and Joni. Thank you for being with us today and for your time. I would just remind viewers to send us their question using the hashtag AskWHO if they're watching us on Twitter. If they're watching us on other platforms, please submit your questions via comment section. Janet, maybe we can start with you, as WHO published a clinical case definition of post-COVID condition last week. So can you tell us what's the definition and why it was so important for us to get that definition, how it will help people to get the right care?
Thanks so much, Alex, for the question, and good afternoon, good morning, good evening, colleagues that are out there listening. It is very important that we publish the clinical case definition of post-COVID-19 condition, what is also called long COVID, as you described. And I'm going to read it out because it's important to just say it. It occurs in individuals who've had a history of probable or confirmed COVID-19, usually 3 months from the onset of the COVID-19 symptoms, with symptoms that last for at least 2 months and that cannot be explained by an alternative diagnosis. Common symptoms include fatigue, shortness of breath, cognitive dysfunction, but also others, and generally do have an impact on everyday functioning. The symptoms may be new in onset following the initial recovery of the acute COVID-19 episode, or they can persist from the initial illness. Symptoms sometimes fluctuate or relapse over time. Why is this important? This has been, a big global need to improve the recognition of patients who are experiencing living with post-COVID-19 condition. And so a standardized definition allows that people get recognized, so that the clinicians, the health workers, the community workers will or the patient themselves or their families can kind of recognize better that the condition may be existing if you have some of these symptoms lasting, as I've described. So it helps clinicians then identify patients, or patients identify themselves and go seek care. And then patients can be started on the appropriate care and treatment pathways. It also will help us, I think, understand the magnitude of how many cases or patients are living with post-COVID-19 condition, so understand the prevalence globally. And finally, also, we want this to promote more standardized research. So with a single definition, we can try to kind of synergize the global research efforts and improve our understanding of this condition. Thank you.
The definition, we worked with different groups and patients who are affected with post-COVID condition. And today we have, as I mentioned, Joni, who is the representative of Long COVID SOS Group. Joni, good afternoon. And could you please tell us and share your experience with us since you got infected with COVID and then with your post-COVID condition?
Hello from Finland. I'm Joni Savolainen. I was healthy before the COVID hit me in last March 2020. My initial illness was quite called mild, but it was nothing compared to mild because it lasted the acute phase lasted over 3 months. And I was pretty sick, even I was not hospitalized with the COVID in acute phase. I had a neurological issues. I had issues with my lungs and issues with my muscles and a lot of different symptoms, but I haven't had in any disease before in my life. And after 19 months, I'm still having the relapses and some weird symptoms still comes back every now and then. Usually they came back in the acute phase around 1 month cycles, and you knew in the morning when you wake up that in this day will not be a nice day because there are some symptoms coming back. And now 19 months later on from the acute phase is still feeling the symptoms, and the symptoms are neurological and chest pain and pain in the legs and pain in the fingers and pain in the toes. Some symptoms are new, what I didn't have before in long COVID, and some are still the same, like bone pain and fishing sensation in your head, fishing pain in temple area around here. Some of the symptoms are usually on other side of the body, and some are in different parts of your body. So it has been quite long ride and ups and downs, like everybody is feeling the ups and downs and relapses and so on. So it's not has been nice time.
Thank you so much, Joni, for sharing your experience with us. And this is also a wide range of symptoms that you as one patient are experiencing. But Janet, maybe you can tell us what is the range of symptoms that we know so far that people with post-COVID condition may have?
Oh, it's a complicated question because there are many different reported symptoms that have been described from studies and for patient experiences. We chose through our Delphi process. So the way we made our case definition was to do a consensus process. We surveyed people from around the world on what symptoms should we kind of say specifically in the case definition. And there we came up with some of the more common symptoms such as fatigue, shortness of breath, and the cognitive dysfunction, which may be troubles with memory or maybe troubles such as brain fog. But we do know that's just 3 common symptoms, and it's not all the symptoms. So people, as you just heard from Joni, they can have very different kinds of symptoms. They can have chest pain, they can have neurological symptoms, they can have trouble with their smell and taste. So the types of symptoms can be wide ranging, affecting different systems of the body. So I would say if you have had COVID-19 and you're experiencing either symptoms that don't get better after, after 3 months, which is what we wrote in our case definition, or you develop a new symptom that you hadn't had before and you're just not sure what that's from, then go to seek care from your provider and have them evaluate you, see what's causing this, and could it possibly be the post-COVID-19 condition or long COVID.
Thank you, Janet. And is there a treatment for post-COVID condition?
So right now, there's no one drug for post-COVID-19 condition. As you know, for COVID-19 itself, for the acute phase of the disease, we're just now starting to find new therapeutics, which is good. But for the post-COVID-19 condition, we do not have one drug. What we do have, though, is care pathways, meaning that if you have, let's say, functional limitations such as fatigue or such as shortness of breath, or the brain dysfunction, then when you go seek care, what we are recommending is that the care centers have integrated care, multidisciplinary care, rehabilitation interventions, so that interventions can be done. And there's more we're learning about this. And if you're interested, we'll have the webinar we had last week on the website in the next couple of days. It's not live yet, with the various presentations of different rehabilitation interventions and care models that can be done to care best for the patients that are experiencing such symptoms that are affecting their lives.
Thank you so much, Janet. And Joni, we actually haven't spoken much about long COVID SOS group. We just mentioned that you're a representative, but maybe you can tell us a bit about the group and how you as patients with post-COVID condition are supporting each other.
About the long COVID SOS, I think this everything comes back in 1 year ago. In last July or last August, the members of long COVID SOS make a huge video in YouTube, and they presented in there, and then they started to message. I think it was Janet who was the main contact in WHO, And then we had the first meeting with the WHO in last August regarding the long COVID, and I was part of that meeting. Long COVID SOS is bringing the people together who had the COVID and now has the long COVID, and trying to help the patients through support groups and so on. And we are doing the same in Finland. I was the creator, or I was making some YouTube videos on last March to December around that regarding the COVID symptoms, and then I created the YouTube. No, not the YouTube. I created the Facebook support group for the COVID survivors on last April, and now there is over 5,000 people joined on that group, and people are getting help from that support group because nobody is knowing what this disease or sickness is doing to us. So that's from the long COVID SOS and from Finland.
Thank you so much, Joni. Janet, here is a question from Veronica Douglas, watching us on Facebook. What policy WHO have in place to help frontline healthcare providers battling post-COVID in various countries?
Thanks for the important question. So, what do we have in place to back up healthcare workers that are caring for patients with post-COVID-19 condition, if that's the question that I understood? We have in place right now a few important documents. The first one is the clinical guideline. So back in December of last year, we did publish our update to the clinical guidelines, and that did include one chapter on the initial guidelines for the clinical management of patients with long COVID or post-COVID-19 condition. And in there, you can see we do recommend one, recognition, two, an integrated approach, as I've already described, for care, and that those should be put into place into the health system. Now, most recently, as you can see, we've published the case definition, the clinical case definition. So we do hope member states and policymakers can use that now to both do better surveillance of this condition, as well as implement the appropriate resources into the health system in order to ensure that these patients can be cared for in this integrated, comprehensive way. And then third, my colleagues in the rehabilitation group that helped deliver that webinar last week are right now working on an update to the rehabilitation guidelines for post-COVID-19 condition, and are right now assembling the experts and patients together to write those guidelines. And we do hope that that is available towards the end of this year.
Thank you so much, Janet. And we've got the next question. One of our viewers is asking, can post-COVID condition affect children?
So again, a very good question. The information on children. So we do know children are less likely to get severe illness and severe and critical COVID-19 from the acute perspective. However, the prevalence of this post-COVID-19 condition in children, I think, still needs to be further described. But we do know it is happening in children as well. We just don't know, is it as common in children? In adults, in adults, we do know that people can get post-COVID-19 condition regardless of the initial disease severity. We have seen that. So like Johnny described, even if someone was managed as an outpatient, considered mild or not needing acute hospitalization, that the symptoms can develop and they can be very cause significant limitations in daily functioning. So more information and more research needs to be done on pediatric population, on smaller children, and to see if how much they will experience a post-COVID-19 condition. And also I wanted just to highlight the definition we have right now. We do know may have some limitations potentially in children where it may be harder to elicit some sort of symptoms from children. So we are working with pediatrician research working groups in order to see how to adapt the definition for children.
Thank you so much, Janet. And you mentioned we are working with different groups. So maybe both you and Joni can explain us how we are working with groups of post-COVID condition patients like long COVID, SOS, and others. Maybe Joni, you want to start?
Yeah, I can start. I think we can work together so that we have the information shared around the world throughout the WHO and throughout the different patient groups in around different parts of the world, and making that what kind of this disease and how it's moving forward in us, because some people are not recovering in any states because the persistent illness is still coming back and nobody knows still why.
Thank you, Yanni. Janet, any comment from you on collaborations?
Sure. I think I just want to acknowledge what Yanni said at the beginning. You know, the first interactions we had with Long COVID SOS were to bring this to WHO attention and to actually set the initial strategies of what we were going to work on. So that was definitely a partnership with Long COVID SOS and with patients that were living with long COVID. That helped us set up the 3R approach, which is what we began with, which was the recognition. So getting this case definition, the research aspects, and I want to highlight again what was just said, that the need to understand the mechanisms of disease, what's causing this, what's causing the different types of symptoms. Is it the same thing? Is it different mechanisms? So that we can better understand how to treat it and actually develop more targeted treatments. And I think that is an important piece of work that still is ongoing. We know many people are working into this, but needs to continue so that we can find an answer. And then rehabilitation. So those 3 R's were what we started with, and that was from the initial collaboration. The definition we developed was developed alongside patient partner groups. The webinars, we've had the 3 that we just finished, again, also working with colleagues, clinicians, researchers, policymakers, and different public health organizations and patient groups, patients themselves, and also patients who are researchers or patients who are clinicians. So maybe coming from, you know, those 2 perspectives. Mm-hmm. So for us, as we do with everything at WHO, we like to work with groups from all regions of the world. And so the Long COVID SOS group has provided us with a lot of good colleagues from different parts of the world as well.
Thank you so much, Janet. And we got a question from one of the viewers asking, what is the main mental health problem that people with post-COVID condition may have? Are we aware of some mental health conditions?
I'll start to answer that, but maybe Yoni also wants to answer that. You know, I think the symptoms that have been described that are mental health symptoms are anxiety and depression. Those 2 symptoms have been described in the various researches that have been published. Again, since we don't fully understand the mechanism of disease of the condition, it is complicated to kind of put the whole picture together. So, but those are 2 mental health aspects that have been described in patients with long COVID, and as well as I think mental health problems in general during the pandemic, and those with post-COVID and those without post-COVID has been highlighted, and the importance for mental health care also highlighted here at WHO. Over.
Thank you, Janet. And Yoni, any of examples from the group?
No, I don't have anything to add, because that was well said, because it really can affect in your mind the whole disease. And when it's not ending the symptoms, it also affects that if you are not getting any help for any of those symptoms, and they still continuous, it's affecting every daily things. So well said, Janet.
Thank you, Janet. Thank you, Yoni. Here's a question from Nino Bukia. When is a good time to seek care? Sometimes long COVID symptoms might not be getting in the way of daily activities, so patients might not think they need to seek care, but might actually need to. So how to make the judgment when to seek care?
That's a pretty good question, because those symptoms can be very weird sometimes. And I think if you have some issues regarding neurological that you are not seeing quite clear, or you are having issues when you are speaking, or something is not correctly, and your family is noticing that, then I would suggest that you will seek care as soon as possible.
Thank you, Yoni. Janet, do you have anything to add?
I agree. I think, you know, everyone knows themselves the best, I guess. But if you're not recovering, from your acute disease, if you knew you had COVID and you're not recovering, that there's a symptom that's lingering, or that you're not feeling just like yourself yet, I think it's good to get care, right? And to talk to a health professional to describe the symptoms. And then maybe they say, okay, why don't you wait another week or two and let's see how things evolve. But then you can start to kind of track with someone alongside of you to see, to kind of monitor the symptoms and see how they're evolving, if they're coming and going, if they're relapsing, if they're fluctuating, if they're persistent, those sorts of things that I think alongside a healthcare provider, that type of relationship can help make the diagnosis sooner. And also if interventions need to be done, get those interventions started sooner rather than later.
Thank you, Janet. We also got a question about post-COVID condition in pregnancy. Do we have any particular advice or information that it can affect a pregnant woman?
That's a good question. I don't have a specific answer for that. I think that's still something that we need to better understand in that subpopulation of pregnant women. So thank you for raising that. I think it's an important thing to raise on this talk. But I don't have any further information on that. But that's something that we will bring back to all the information that we're trying to synthesize. So what we try to do is, with all these publications, is try to put it all together and make sense of it, so then we can share this with the community at large. So that is an important point. Thank you.
Thank you. And Janet, maybe I'm aware of time that we don't have much minutes left, but maybe the last question that you can answer is about vaccines, whether they prevent patients from getting post-COVID condition, or does it help to reduce symptoms? There was quite a lot of comments around vaccines and post-COVID conditions. So what do we know about these two?
Oh, again, another great question. So we think, the vaccine's ability to prevent post-COVID-19 condition, we believe, depends on its ability to prevent infection in the first place. So again, number one is prevention of COVID-19, and all those vaccination, all the other public health interventions that help prevent transmission, prevent you from getting sick in the first place, are important. However, we do know that vaccines mostly are very effective in preventing severe disease and death, but sometimes someone can still get infected now. So if they get infected, is there some protection to developing long COVID in those patients that are breakthrough infections? And that we're not so sure yet. There is some studies that are looking to see, if you were vaccinated and then you got infected, and let's say you had symptoms, how long do your symptoms last? And are the symptoms persisting, or are they shorter than other people? And I think that's where there's some interesting research that's being done to kind of quantify if patients who've been vaccinated but then develop infection, if they will be less likely to have long COVID, and we just don't have the answer yet.
Thank you, Janet. And Yanni, what is your advice for people suffering from post-COVID condition?
Seek care when you need it, and take day by day. Don't stress too much, and seek the support groups, because you will get the help from the other patients who are suffering in the same situation. That has helped a lot of people in Finland. So
thank you so much. Thank you so much, Yanni, and for your advice, and also for sharing your experience, but also for what you do with the group to support others. It's very much appreciated. And Janet, any final advice from you for people suffering from post-COVID condition?
I echo what Johnny said. Watch your, take care of yourself, right? And if you're noticing, again, early recognition is key, seeking care is key, and engaging with the healthcare system, I think is very important. So I think with patients, that's important to monitor yourself, that your symptoms do resolve if you get acute COVID, that if they don't resolve within the right time frame, or if they're bothersome in some way, if you're concerned, then seek care and get an opinion, get a healthcare worker to be your partner in trying to sort this out with you. And then for those of you that are out there doing clinical research, on treatments, on understanding mechanisms of disease, that it's a really important piece of work to continue and advance our understanding of the post-COVID-19 condition so that we can prevent it and treat it better and hopefully find ways to resolve it so it doesn't continue to affect people's lives.
Thank you so much, Janet, for your time and sharing with our viewers what we know at the moment. I'll just use this opportunity maybe for those who are still in good health to be careful and follow all the measures. Wear a mask over the face, keep the distance, make sure in a well-ventilated space or open windows, clean your hands, and yes, avoid crowds and get vaccinated when it's your turn. I guess those measures to prevent infection are the best way to prevent post-COVID condition as well. Please stay tuned with more information and updates from us. As Janet mentioned, there are more information to come in following months, hopefully before the end of the year on this subject. And until next week, stay safe. Thank you.
Thank you.
Thank you. Bye-bye.